Okay, welcome back, and thanks for joining me again. If this is your first time, welcome. I am just a average programmer, just talking about the data, analyzing the data for coronavirus, specifically more like the deltas, the day-to-day changes in data, and I'm representing that by a percentage on this spreadsheet. Yeah, we have a kind of like a scary Friday evening, I think. This is things are not looking that good, and I'm not sure about you, but I haven't really been tricked into thinking that things are going to be good, have been kind of like good at all so far, but I do sort of like fluctuate between thinking that things are getting better and then thinking that, and then just like being scared and then sort of like, being struck with the gravity of the situation. So I think today is just one of those days where I've been struck with the gravity of the situation. And it's because the data is a little bit overwhelming today. I mean, it's a little bit mixed in parts. Like, if you look at the actual trends, it's not as bad as yesterday. But some of the stuff that I'm hearing on probably, throughout the Reddit and Twitter communities, it's probably got me more on edge right now than the actual data. And it's not to say that other days I feel elated. I've never gone through any feelings of elation yet, but I do fluctuate between feeling sort of normalized with this situation and then panicked. But normalized is kind of in the middle of elated and panicked, and definitely haven't gone into past the normalized feeling yet. So I can kind of, let's just go into the data. I can kind of like show you a little bit about how this is affecting me emotionally today. So, and with that, I'll take a sip of beer before we get started because it's helping me right now. All right, Henderson Stout. It's a local Ontario craft brew. One good thing is a lot of the craft breweries are actually keeping up their deliveries or starting their deliveries. So, it's another reason not to leave the apartment. I also have a new space set up. My wife and I set this up. You can't really see the little desk that we have, but it alternates between standing and sitting. I like to sit, she likes to stand, so right now we're going in standing mode. So anyway, let's go into the data. So if you look at, actually one thing I've done today, before we go into too much of the stats, but I have actually done a drop down list for this. Now the only thing is that I can select, say if I just go to global minus China, I select that, and then everything will change with a bit of a delay, but everything will change. And that doesn't really look like it's changed much anyway, because global with China is actually just like it's not really that much of a difference as far as it's like, versus global. Oh, wait. Okay, so this is so I lie. This is actually got to go down. So you're going to see me like do a live tweak here, I guess. Let's just do this, and what's this gonna be? A5, B30. Okay, so this should be. Okay, so I want this to get the actual entry that I swap here. So this should be B4. Oh, okay. So, okay, and I'm new to spreadsheeting, so this is where my sort of inexperience comes in. I mean, I might be a programmer for quite some time, but. Oh no, actually, it's A4 that we need, and so this is going to be the row that we're in, so that's fine. But why isn't this picking up A4? Because that's picking up A5 instead. Okay, there we go. So same thing here. Oh, for some reason this hasn't extended, so you're seeing a little bit of what everyone who's a programmer hates, live programming. So this is going to be B31. Whoops. So that's A5 again. So it needs to be A4. Sorry, this isn't supposed to be really a programming podcast. Just one more. Because I want to show you this. It's pretty cool. Okay, so this is going to show... So this is Australia, my country of origin, before I became naturalized in Canada for 10 years. So this is a confirmed increase of confirmed cases of 333 today. So they're a little bit down from yesterday. Thankfully, they've had no deaths today. It's still sitting at 13 as of yesterday. So if I go to and look at the WHO rate, all their rates are pretty low right now. So maybe it is something to do with the weather, because Australia is coming off their summer now. And that's still unproven. There's a few theories about if the weather has anything to do with it. But yeah, as far as I know, it's unproven at the moment. But who knows? So anyway, let's look at the global stats right now. So our confirmed cases total is up to 593,521. And that's an increase of 55,336, as you can see here. Now the percentage is down a little bit, but granted, we still have a couple of hours to go, so this might be different. But usually when I'm giving these updates, I'm giving them about the same time every night, and they're usually just like the deltas don't really get changed that much from 10 to 12 midnight in Eastern Standard Time, because I think Europe is still waking up, and that's kind of the epicenter of the virus now. And America and Canada has given all their numbers already. They usually give it at about, I think, throughout the day up to about 5 or 6 p.m. I think, and up to about 7 or 8 p.m. sometimes. But not really a lot of numbers come through after 9 or 10. So yeah, these aren't really going to change that much. And thankfully, confirmed cases look like they're down a little bit. Well, a little bit being 8,000, and that's a little bit now, given the context of things. But unfortunately, deaths are up. So they're over 3,000. I actually think this number, maybe I did something wrong here, because I think this number might be a little bit high right now. Okay, you know what? I'm just going to go back to this sheet for now. Okay, so yeah, if I go back to... Okay, this should be updated anyway. Okay, so if we look at the Johns Hopkins dashboard, this is actually where I get a lot of my updates from. So that's 27,333 now. I must have done something like hit a undo button somewhere or something, and it must have just like messed with things. Okay, so that's it. So the increase is actually at 3,139. Let's just double check to make sure our recovered is up to date. I got, yeah, okay, so 131,007. And then what's the confirmed cases at now? 595,953. Okay. Sorry, what is it again? 953. Okay. And don't worry, I don't do this for like every one of these entries. I have a script that runs for the individual countries, because there's like, we got 4,000 lines up here. But it's just that I update the global more frequently, so a lot of times I actually just go into the dashboard and update it with the numbers manually. So anyway, you would have seen, if you were watching, you would have seen these numbers update automatically, this one and this one as well, and also the increases. So this is just all math or whatever, so everyone knows how spreadsheets work anyway, so I don't need to really explain that. Yeah, so 10% there. Let's see if this is updated now. Okay, so this is up to date now. Cool. So yeah, you can see about 10.73% for confirmed growth. So that's actually down. That's down the most since 23rd of March, which is, after about 4 days in a row of it going up, it's kind of a relief that it's gone down in terms of the delta anyway. The death growth, I mean, this could be on par with yesterday by the end of the night, who knows, but it's slightly down, but it's still kind of hovering around those low teens, and it's been doing that for a while now, for about 10 or so days. But that means our raw numbers are consistently up, and now it's like at a all-time high again to 3,139 as of now anyway, 10 o'clock Eastern Standard Time. Number of recovered is 131,007, and that means that our recovered, so we haven't had as many recovered people recovering as much as relatively passing away. And so, sorry, I was trying to be polite there and not say deaths too much, because I'm just, sometimes when I look at these videos I just think, oh my gosh, I'm saying deaths a lot, but I could call this fatalities, but I don't think anyone's going to get offended about this. It just makes me feel a little bit upsetting just talking about deaths all the time. But so anyway, we've had more people dying than we have of recovering, and that's why this continues to climb, this recovered death rate. And so that's at 17.3% now. The WHO death rate has gone up another 0.1%. It's been doing that every few days or every couple of days, and it was at 4.3% for 3 days in a row. Now it's at 4.4%, and the incubation death rate hasn't gone up as much as it has. Well, I guess it kind of has, like in the last couple of days. It's gone up about the same amount, but it's still in the 15% range, 15.8%. So, what else to look at? I think we can look at a couple of countries, because I think Italy's is up maybe, and then Spain's is down. One of those countries is up and one of those countries is down. So, so Italy has had their largest amount of deaths increase today at 919 deaths, and that brings their total to 9,134. The rate is staying about the same for the last 5 days, but so that still means there's an increase in raw numbers, and the WHO death rate is up a little bit. The recovery death rate is still staying about the same overall though, and the number of cases has kind of stayed around that. That's a big range, but 5,000 to 6,000 per day look at that, even just the last week, even borrowing that number. So if we go to Spain, I'll just say another thing about this little selection list here. Now, I've got this sheet on public view, but unfortunately I didn't realize this until I actually was trying out in another account, and anyone who has viewing like this, like viewer privilege instead of being able to have edit privilege like what I do, because I'm the owner of the spreadsheet, can't see this drop down. So at this point I'm like, geez, why didn't I just build this in a website instead? I was thinking spreadsheets were simpler, but now I'm just kind of getting burned with this. And yeah, this drop down I think would be a lot simpler if I was just building a website, but who knows, maybe there's something small missing that I want to make this drop down public. I want anyone to be able to select a country ideally and just alternate like this, because right now their only option is just to scroll down, just endlessly like this. And yeah, I just don't think that's very nice. So anyway, looking at Spain's, so the confirmed increase is down for 3 days in a row. At least that's good. But their death rate is about the same. So the last 3 days have been kind of like a new kind of peak for them, between 700 to 800, mostly anyway. And their WHO death rate is going up a little bit because of that. Their recovered death rate is going down because the recoveries are actually looking pretty strong, and their incubation death rate has gone down by a lot. So I think that's because of the confirmed cases increase. Now, looking at the US, I don't think it's maybe they've had another 400 deaths today. So they're still relatively low compared to countries like Spain and Italy, but they do have the most amount of confirmed cases by far. Not a record, so slight decrease of yesterday. But the increase from yesterday was pretty substantial over Wednesdays anyway. So yeah, it's a good amount of confirmed. Well, I mean, I say this correction every time I give these updates, but it's a good amount of testing they're doing, I guess, if they get in this many confirmed cases. Like, so I don't have that data, but maybe they've done 1 million tests now, and 100,000 of that has come out positive. So the number of deaths, unfortunately, that's increased by 372 today, up from 267 yesterday. And yeah, the death growth is around about the same this time at 30%. This is the number that I like. I think this is why Johns Hopkins is going to restrict this whole recovered death rate next month. But the WHO death rate is up a little bit too. So, okay, so I don't think there's anything else to talk about in this. So I think I'm just going to go on to some interesting things I saw on Reddit today. Okay, so this is one thing I mentioned yesterday, and I didn't have the this thread up yesterday when I was mentioning it, but I was talking about why I prefer the going by the recovered death rate and not the confirmed death rate that WHO likes to use, where they compare the number of confirmed cases with the number of dead. And it's because there are 2 periods of time, like my, if you kind of understand my very sort of like cheap looking markdown style diagram, T1 and T2 are 2 different points in time. So I'm explaining it to someone that kind of asked me why I prefer that. And I said, so I gave a bit of an explanation up here, and this is in the China flu subreddit if you're interested in just seeing this. But I go over this graphic and I say, this might explain it better. So if T1 and T2 are points in time, you can assume it's 14 days, because that's the often touted period of infection, I guess, or whatever you want it to be. It could be 30 days if you want. So, we haven't solidified these. These are just 2 periods in time. I'm interested in comparison only in the T2 period, this column down here. So, to me, comparing data from 2 different points in time, T1 and T2, is weird. I'd much prefer to compare T2 with T2, and that's why I like to see recovered versus dead. And I think that's what most people that are analyzing data would prefer to look at in terms of determining trends as well. Well, it's just that WHO is questionable at this point, and even if that's at worst, but at best they're trying not to instill panic, and a lot of the governments are trying to not instill panic either, so they're often quoting this number too, but it doesn't always give the accurate reflection of things because it's comparing 2 different time periods. I hope we explained that better. So so the next thing, one thing I saw on Reddit today, on the subreddit CV News, the video of Jamaica Hospital Medical Center in Queens, New York City was deleted from Facebook. Before it was, I saved it and uploaded it to YouTube. So I'm not going to play this, but you can check this out in the subreddit. But it's basically, it's a little disturbing, but it's not like there's any kind of like horrible things happening. It's just a bunch of patients lying around, but you really see the number of people at this hospital, and that's what it's mainly communicating. I'm not sure why it was taken down. It's kind of more people are going to seek it out if things like this are taken down, and there's no graphical content or anything. But yeah, that is worth watching, because I'm not sure why they have so many people basically in just like the New York City hospitals and any kind of city hospitals, when they could just bus them, a few of them, to upstate regional centers. I don't know, maybe there's a good reason why they're not doing that. Another thing that caught my attention on the coronavirus FOSS subreddit, wearing a face mask, it was also in the life hacks subreddit, posted a day ago, so maybe you've seen this already, but wearing a face mask for an extended period of time. Sew a button to a headband to keep them from destroying your ears. And if you saw a post a few days ago I highlighted of Italian medical workers, doctors and nurses there, they had a lot of face markings, and just like from extended periods of time of wearing glasses, the goggles, I guess, and also the face masks. And these face masks aren't really made for like extended periods of time, I guess. So I guess they're also wearing around wearing pretty bad around the skin of the ears, and so this is a good idea, just like wrapping it around a button on the headband. Kind of cool. So this I saw again on the coronavirus false web subreddit. Riot begins in China over alleged bridge closing on Jingxi-Hubei border. Apologies if I'm not saying that correct. Due to virus lockdown, even though the lockdown has been considered lifted. So this is kind of a theme that's coming out more and more now. And there's another couple of things I'm going to highlight with this, but there's been a little bit about, is this virus spreading again, or a combination of that and a combination of that, and how accurate is China being with their numbers. So that's starting to make a little bit more noise now, those two kind of themes. But this is something to steal from Monty Python now for something completely different. This is a coyote being seen. Coyotes are seen on the streets of San Francisco as empty, and kind of like these kind of scenes remind me of the stuff on I Am Legend with the lions walking around and stuff. But yeah, it's it's a little crazy. I mean, this isn't so strange because it's on a highway, but this is kind of weird. I'm not really sure which particular section this was. A coyote on the streets of San Francisco during the coronavirus shelter-in-place order. Definitely the coyotes look a little bit smaller than out there than what they are out in the east. When a lot of the coyotes are supposed to be like hybrids between wolves and coyotes, like out in the northeast. So coyotes are seen around here in Toronto are like a bit bigger than this. But yeah, they're smart and they're adventurous. If they get, it only takes them a few days. If they realize that they can get away with being somewhere, they'll take it. Wuhan flu on this subreddit. There's a lot to get through tonight. If China knew of the outbreak way before they told WHO and covered up things, this is a crime against humanity, says Italian politician Matteo Salvini. Sorry. So, yeah, this is again something with the theme of the Chinese government need to become more accountable, and are they covering anything up, and that sort of thing, and are they telling the truth about quarantine and being over and stuff like that. This came up from Bloomberg Technology. Quarantine doctors are turning to video appointments to keep seeing patients without the risk of exposing them to COVID-19. So that makes sense. I have a doctor appointment coming up in another month, or another 2 weeks now, so I wonder if my doctor would tell me about that, and if she's moved over to Zoom. But yeah, a lot of people are doing Zoom now. This is something that's from the New York Times. This report from Italy is chilling. Anyone with fantasies about quickly getting back to normal should read this to disabuse themselves of such nonsense. Almost 1,000 people died in Italy yesterday. So it's a really good, well put together presentation for the New York Times. They often do these things where they look really great on websites, and it's a really well presented investigation then, or reveal of what's going on. And yeah, this is what I mean by this same feeling resonating with a lot of people now. Getting back to normal. Are we going to be getting back to normal? Is this thing are people getting reinfected? So this is by someone I know, someone I used to run with actually, but it's a pretty good tweet from him. He's saying, for those wondering why liquor stores are considered essential, those who are suffering from alcohol addiction can go into withdrawals and flood the already strained ERs. Alcohol withdrawals are no joke. Seizures, heart issues, and even death happen. Not ideal, but necessary. So that's a perspective I didn't even know about. Like I didn't even think that liquor stores were open for that reason. But yeah, kind of that's from the perspective of some people who have been through treatment centers and know people that are going through addiction. And the last thing that caught my attention, this is kind of wild. Apparently, on March 13, the Berman Law Group filed a federal class action lawsuit against the People's Republic of China, along with several government ministries and other authorities for its mishandling the COVID-19 crisis. I'm not sure if they got a case here. Obviously, I'm nowhere near a lawyer. Actually, there's a guy I watch on YouTube that does a lot of these things. As a former lawyer. Anyway, maybe I'll just leave a comment on his YouTube and see if he can analyze it. But yeah, it's not surprising that this kind of thing is happening. I'm not sure if they'll get anywhere with it, but it's not surprising that people are going to be holding China accountable in some kind of way. And if there is something, like if there's any kind of trial or anything, at the least, it would be revealing to actually get a bit more truth out, and then we could see actually maybe they're telling the truth. Maybe this thing is better than what we think. Hopefully. So yeah, that's all I have for tonight. Thanks for tuning in, and yeah, I hope you're dealing with this okay. And yeah, I'll be doing another one of these updates both days on the weekend as well. Okay, see ya.